You're listening to Body by Poly. I'm Dr. Alain Polynice, and this podcast is for anyone considering surgery and navigating all the complicated decisions to make before, after, or somewhere in between. Let's talk about what really matters. On today's episode, we're going to be talking about fat transfer to the breast in the context of a breast lift. So this is something I do very commonly because I see a lot of women who come in with concerns about drooping of the breasts, also known as, so they want to lift and shape their breasts, but a lot of them have slight issues with volume as well and asymmetry. So those are two things that can be addressed with fat transfer. So these are for patients who have smaller breasts or droopy breasts, but they don't want implants. They want their breasts lifted and shaped. So the breast lift, or the mastopexy, is a technique where we're taking the breast tissue, lifting it, and having it hold itself up with internal sutures, or an internal bra technique. Once you've done that, then you can add fat to not only add volume, but also correct asymmetry or size differences. So it's a combination procedure where we would first harvest the fat, typically from the back, the waist, the tummy, even the arms or the thighs. The fat that is going to be used for transfer is captured in a very special fat filtration system where the fat is essentially captured and washed. And then that fat can be transferred using a special syringe into the tissue right under the skin in the fatty layer above the breast and behind the breast. And that can add volume to the breast, but also correct those asymmetries. Breast lift with fat transfer is a technique that I use very often to offer patients that lifted look, but still very natural, using their own tissue. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.